As we've been talking about, May is Skin Cancer Awareness Month, and today ABC7 is committed to raising awareness. We've invited doctors who specialize in treating all forms of skin cancer into our studios to take your questions. The number to call is there on your screen, 552-3127. But joining us now is dermatologist Dr. Morgan Donahue. Thank you so much for being with us. And we want to talk about, we talked a little bit about melanoma, the deadliest form of skin cancer. What are some of the latest treatments?
Well, Lauren, traditionally therapies like chemotherapy have been used and have been used with a lot of side effects and not a lot of results. And today we're using more targeted therapies. Some of these would include using antibodies to block the pathway that allows melanoma to progress. Other pathways would include using medications that upregulate or stimulate our body to help attack the cancer. We're also using vaccines. So we take part of the cancer, we actually use it just like a vaccine for the flu or for the measles or mumps. And these therapies are still evolving. They're not incredibly effective, but they provide some relief for somebody with very bad melanoma in some cases. Ultimately, the best way is to promote prevention, get checked regularly, and get the word out that skin cancer is a very common problem, unfortunately, and shows like this help us do that.
And immune therapy is something that's being talked about a lot.
It is. Immune therapy is exciting because it can be done with less side effects than chemotherapy, and it's actually in a way natural because we're stimulating one's own immunity, things like interleukins and other chemicals in our body that can help naturally kill cancer cells.
So I know you've been fielding phone calls here today. What are some of the most common concerns that you're hearing from
Well,
viewers?
I've actually had a lot of personal stories. I just got off the phone with a nice woman who lost her son at age 40 to a melanoma on his back, and so it's a lot of people similar to what I see in my practice, folks who've had personal experiences and are just trying to tell me what their problems have been.
Well, an important reminder that we all need to be vigilant and get checked. Dr. Morgan Donahue, thank you so much for being with us here today. You again can call that phone bank. The number is 552-3127. Right now, we'll send it over to Bob.